can OCD come back?
Right.
And I would say, yeah, but I almost don't even look at it as can it come back. I look at it, it's always there.
Right.
It's just, how do you learn how to handle it or not handle it?
Right.
is more of the big deal.
Right.
Right.
So exactly right. I think, OCD is chronic, right? You're going to have it, and because everybody has unwanted thoughts, like 100% of the people, and so people in our population have it. So based on that, right, you're never going to prevent a lot of these unwanted thoughts, images, or urges from popping up. The question is, though, how can you manage those thoughts in an effective way, right? And most people transition from thought to thought automatically, whereas people with OCD, they focus on the thoughts and try to continuously find the meaning behind them. And so, I think from a personal standpoint, there were times where, I would be fully managed for months, and then all of a sudden have like a period of where I would consistently start to ruminate more and more. And it's just, from when those moments would occur, it was simply because I started re-engaging in a lot of that compulsive activity, right? The safety-seeking activity. And so, it's really a matter of how can you resist doing compulsions long enough, and if you can continuously resist, you will not have issues with OCD. But if you start re-engaging within compulsions, then that's when it starts to creep back. So just understanding why it creeps back, that's important to know. And people with OCD, because they're typically finding those safety-seeking actions as support in that moment, and it's not effective, they typically will. The condition typically gets worse once those actions occur, and so it's all about managing those safety-seeking actions and preventing them from occurring.
And really, ways that we can think about keeping it at bay would be, after you've done whatever level of treatment. We'll talk more about levels of treatment in a little bit, but I would say you've got to make sure that if you're on a medication, that you don't just stop it.
Right.
Never a good idea. Right? There are so many people who have come back to me for treatment again because they thought, well, I was out of treatment for 2 years. I figured I don't need the meds anymore because everything's good. I just stopped it. And I've seen people within a month or two just crash horribly.
Really?
And if you're going to come off of it very, very slowly. It might be a year or two process of coming off the medication finally.
Really?
Otherwise, there's just so many stories of people that I have seen who have come in who tried it on their own and it worked just against them so bad.
Right. So what do you recommend in terms of working with a psychiatrist? Do you recommend having that psychiatrist call the shots in terms of how to taper off the medication, or do you recommend people?
That's their job. That's what they know how to do and help people do. And it might be slower than somebody wants it to be for certain meds. It might be a little faster than they'd like it to be for other meds. Like if it's a benzodiazepine or something, they might want to go a little faster, the psychiatrist, than anyone else. But it is important to make sure that you do that under the guidance of an expert who's in that field.
Definitely.
And not just try to do that on your own.
Definitely. I think too, in terms of making sure OCD can be managed, it's really important to have a healthy lifestyle, right? So personally speaking, when I exercise, when I sleep well, when I eat healthy, that's typically when my OCD is in the most dormant state, right? Where I can go to school, work, not even worry about the condition. When I start to feel stressed, when I don't live a healthy lifestyle, when I'm not exercising as much, that's when OCD finds its way to creep back in. And so I think as people are going through recovery with the condition, it's essential to focus on not just the verticality of treatment, the exposure response prevention, the medication, but also it's important to think about the general wellness as and too, where people can, it's important to sleep, it's important to consistently stay active and to eat healthy, because that all plays a role in managing this chronic condition long term.
As a therapist, I often suggest booster sessions once in a while. So even if you're doing well, get on my schedule every 3 or 4 months. Just for us as a check-in to make sure that things are going okay. You can spend the entire session telling me that things are awesome. That's great. Definitely. But I have found that connection keeps people kind of on task and knowing that I'm still going to have to go back once in a while and fill them in on what I'm doing. So it helps to give them a little bit of drive and boost to keep working on the stuff they need to work on.
Definitely. And to your point, that's been one of the drivers in our protocol in OCD, right? So Dr. Lansway, Dr. Fiesner, who are leading our clinical team in the growth of our NOCD therapy service, they actually are providing those booster sessions too. So people who don't have access to treatment after seeing or going through their ERP protocol can find ways to reconnect and get support. So that's something that we've also taken into account as well. I know, so given your point, right? It's just if this is a journey with this condition and managing it, then you need to have those booster sessions every once in a while.
Absolutely, and always doing exposure therapy. I tell all of my patients, do an exposure every day.
Right.
That no matter what's going on, make something into an exposure for yourself to do, to challenge yourself a little bit.
Yeah.
So.
And I think that's important too, because there's really no cure for OCD, right? So like if there's no cure today, what's the best way to manage it? It's like, well, it's to stay on top of your toolkit, right? Making sure like you have you're moving at your fastest pace possible with the treatment, and once it's done, right? So once you're done, instead of taking your foot off the gas and going back into your old ways, you instead can go and keep going with it.
Absolutely. Which again, sometimes people don't want to do, because there's this idea that I finally dealt with my OCD, now I can put it behind me and I never have to deal with it again.
Right.
And therefore I don't want to see the doctors and I don't want to see the psychiatrist. And unfortunately, for most people, that doesn't work really well.
Right. And I'll tell you, it's from a person going through it, by going and keeping up with treatment, after a while it becomes second nature, right? So that's why you want to continue the pace. You don't want it to feel as if it's work. You want it to become part of your lifestyle, where you automatically will maybe have a thought, and then you know confidently you can manage it in an effective way. And so you want the kind of the ERP lifestyle to go with you, and to do that, it's just you right through treatment, you have to keep pace. So that's kind of that's from a personal perspective. That's